Start.
Good morning. Welcome to my channel. Today we are going to discuss about sterilization. So before entering into the topic, introduce myself. I am Dr. I. Somasundram, Professor, Department of Pharmaceutics, SPS, VISTAS. So sterilization. So the importance of the sterilization is very important in pharmaceutical as well as in the health sector because the word sterile means free from microorganism. So the free microorganism environment is required in all health sector field, which gives the improvement in the health life. So, what is sterilization? Sterilization is nothing but the environment which makes free from microorganism and the process which compiles the free environment is called it as sterilization. And the free environment is highly required for all the pharmaceutical formulations. So here, why sterilization is important? Sterilization is important because the pharmaceutical products what we are taking, which is helpful for curing all kind of infections. If the product itself having the contamination, so it will leads to the unwanted effect. And also in the health sectors, wherever we are utilizing for the health improvement, and the area must be free from mm, microorganism where it reduces the infection. That is why the sterilization is very much important in the healthcare field. Types of sterilization. There are different types of sterilization which leads to heat sterilization, while dry heat, moist heat, and gases type of sterilization, radiation type of sterilization, and filtration method of sterilization. So each and every type of sterilization will compiles according to the product what we are preparing, which suitable for the product. The method will be adopted because heat sterilization, all heat liable substances, that means the substance which are heat sensitive cannot be sterilized by using heat sterilization. So that is why the different method of sterilization is adopted to make all the products free from contamination as well as free from microorganisms. So heat sterilization. So heat means the heat which is given by the temperature. Most probably it will lead to 160 to 180 degrees Celsius, where the hot air will be circulated, and due to the heat, the microorganism will be destroyed. So how it will be happens? So the principle behind here is when you are supplying the heat, the microorganism has the lipid layer, which the lipids will be degraded as well as the protein will be denatured, and the microorganism cannot be able to survive for their food, and it will be destroyed very easily by using the heat sterilization. In this heat sterilization, a hot air oven is the instrument which is utilized for the sterilization of the glasswares and other materials which are heat liable substances. So that is when you are giving to the temperature, the it should not be affected by the heat. So here the hot air oven is a simple instrument made up of stainless steel with the asbestos gasket will be there. There will be perforated plates will be there, and internally fan will be there. So to circulate the hot air. So when the temperature reaches to nearly 160 degrees Celsius, and the time duration of 1 hour will be maintained as per the pharmacopoeia. The product which are kept inside will be sterile. Most probably the glass materials such as petri dishes, measuring cylinders, pipettes, conical flasks, and other drug materials which are heat stable can also be sterilized, such as granules. Right. So here the temperature rises to 160 degrees Celsius. In there will be a fan, the hot air will be circulated inside, and the heat will be transferred to the material, and the process will start killing of the microorganism by protein denaturation and the lipid peroxidation of the cell wall. So the organism will be destroyed. Next will be the marsh sheet. So there we are using the dry heat sterilization. Here the marsh sheet, that is the using of water vapors. That is steam is the major account of killing the microorganism. So the water will be converted into vapors and it will be converted as a steam. So the steam which has the hot air along with the moisture, so which will helpful to destroy the microorganism. So here also the principle nearly same to the dry heat, where the protein will be denatured due to the temperature, and it is having the moisture. The accumulation of moisture will be there inside the cytoplasm of the microorganism, where the internal osmotic pressure of the cell will be increased, and you can able to see the destruction of the microorganism very easily due to the burst of the internal osmotic pressure. So the 100% you can able to expect the materials will be sterile. So most probably here the liquid materials, that is for the medium, and non-absorbent cotton wools, surgical gadgets, rubber closures, all these materials can be sterilized. So in this moist sterilization, autoclave is an instrument which will be utilized for killing the microorganism. So it is the two type of instrument can be available. One will be laboratory scale, it will be small scale, and another will be the industrial scale, it will be large. So in lab scale autoclave, the water will be utilized. So internally the water will be filled, and due to the heat of water, the water will be converted into vapor, and vapor will be again converted into steam, and the sterilization process will takes place. So it will be made up of stainless steel, and there will be the head face will be closed with the 8 screws, and tightly it will be closed, because the pressure will be the main reason here to killing the microorganism. And in industrial, there will be the perforated plates will be there, all the material will be kept inside. So big instrument will be there made up of stainless steel, and there will be outer jacket. Directly here steam will be supplied. So there will not be water will not be converted into steam. So direct the sterile steam is circulated, and the steam will be transferred the heat along with the moisture, and killing of microorganism will be undertaken. So most probably the principle here, steam under pressure. So the maintenance of the pressure is very, very important. So most probably the 15 lb pressure as per the pharmacopoeia, here it will be followed, and you can able to see that the pressure has to be maintained. It should not be exceeded, because due to exceed of pressure, it may be leads to any accident. Next comes the radiation method of sterilization. So the ultraviolet rays main will be the utilized for killing the microorganism. So this widely you can able to see it in the laminar airflow bench, where using in the research area or laboratory scale area, where the transfer of microorganism will be done. So the main principle behind here is the ultra radiation will mutate the cell. It means the DNA will be mutated. That is, the dimer will be formed. The sequence will be converted into dimer. So that will codes for nothing, means for each amino acid there has to be a code for synthesizing of the amino acid. So the amino acid production chain will be stopped by the radiation. So ultimately the cell cannot be multiply and cannot be grow. So this kind of method of sterilization is used in the research areas, where in the most probably in the laminar airflow bench. And next is the gaseous sterilization. It is also one of the good method. So gaseous sterilization will be two types. One is sterilizing the instrument, and another will be sterilizing the atmosphere. So sterilizing the instrument means the instrument have the small nook and corners where the screws and other things will be there. We can't able to clean it by any other method. So the gas can move internally and can sterilize and can kill the microorganism. The ethylene oxide which will be utilized here for the gases sterilization, and for atmosphere the formaldehyde. So it will be called as the fumigation method. The sterile area will be sterilized by using the formaldehyde gas. That is, by using K-MnO4 and formalin solution, the formaldehyde gas will form, and the same method it kills the microorganism. And filtration method, so heat uh, that is which are heat sensitive materials which can be denatured by the heat sterilization. All these kind of the materials are sterilized by this filtration method. Most probably in pharmaceutical field, the membrane filter is utilized. The pore size of nearly of 0.22 micrometer in size, so it will be very less size than the bacteria. So the filtration and the filtration method will be very much effective. Most probably some and that is antibiotic eye drops will be sterilized by using the filtration method, because they are heat sensitive material which are having the melting point of nearly 60 degrees Celsius. So that kind of materials are sterilized here by using the filtration method. So other advantages in the sterilization is to make all the area will be sterile and the product will be sterile. So the best practice and the application oriented sterilization in wide way in the healthcare sector, as well as in the manufacturing of pharmaceuticals, it will be utilized. So in health sector, not only in the production of manufacturing unit, and also it will be in the hospitals, and wherever the infection spreading area is there, the area will be sanitized by using any sterilizers. It may be it may be chemical or physical method will be utilized here. So one thing, in COVID time, we all are isolated to make the sterile in nature by using washing our hands with the soap and using hand sterilizers. So these and all will improve the health status and also decrease the contamination and the infection towards the patient and the living beings, right? So the practice of free microorganism environment is very much important in laboratory scale also, because when you are using for testing of any microbial test, right, it should not be contaminated with other microorganism. So the free microorganism free environment is more important here to give the accurate result of any microbiological testing. So the lab has to be maintained highly sanitized and free from microorganism. Most probably the entry of the lab will be restricted by keeping the HEPA filters, that is to filter the air, and also internally the fumigation will be done for a repeated time, and all you can able to see the sterile environment inside. So best practice of sterilization is not only keeping the area, and also validation of the equipment which are utilizing for the sterilization. So validating is very important. So periodic validation and maintenance the record of each and every instrument will be the best practice to assurance of the sterile area and the sterile product. So let's we practice to keeping the area sterile and keeping the environmental sterile by doing the best practice of sanitization, and makes the improvement in the health lives. Thank you all.